Welcome to the Deep Dive. Today we're tackling a really fundamental aspect of healthcare, how documents and records are managed. It's kind of the bedrock, isn't it?
It really is. It ensures the whole system works effectively and, maybe most importantly, that patient care is safe and consistent.
Exactly. So we're going to be exploring the FDA's regulations, specifically 21 CFR Part 820 for medical devices.
That's right. But we're also pulling in some broader stuff, articles on healthcare document management systems generally, and even what the Joint Commission International looks for.
Okay. And our goal for you today is really to cut through the complexity. We want you to come away with a clear picture of this regulatory world, understand why good document management is just so vital.
And maybe uncover a few surprising things, too, about the challenges and, where things might be heading.
Right. So let's dive right in. We should probably start with some key definitions from the FDA. They seem like the essential starting point.
Absolutely. Yeah, to really get a grip on these regs, we need to be on the same page with the terminology. The FDA is very clear on what establish means.
Okay.
It's not just thinking about it. It means defining it, documenting it, could be paper, could be electronic, and then, crucially, implementing it, putting it into practice.
Define, document, deploy. Makes sense.
Yeah.
A policy isn't much good sitting on a shelf.
Exactly.
Now, the FDA talks about specific records, like the design history file, DHF. What's the core idea there?
Right, the DHF. It basically tells the story of how a finished medical device was designed. It's a compilation of records tracing its whole design history, its evolution.
So the why and how it came to be.
Kind of, yeah. More the how of the design process itself. And it's critical. Missing pieces there. That could cause serious problems later. Recalls patient risk.
Okay. Then there's the device master record, the DMR.
The DMR. Think of that as the master recipe, the detailed instruction manual for actually making the finished device, all the procedures, all the specifications.
So DHF is the design story. DMR is the manufacturing blueprint.
That's a great way to put it. And the DMR, it's incredibly detailed. It covers device specs like the bill of materials, drawings, ingredients, software specs.
Wow.
Yeah, and production stuff too, like the environment needed, cleaning procedures, equipment calibration, flow charts, how to set things up, the methods.
Okay.
Then quality assurance acceptance criteria, testing equipment, procedures, forms, process control charts, and even packaging and labeling. Specs, drawings, instructions, service manuals, how labels are reviewed and controlled, packing, shipping, even customer feedback related to the specs.
That is incredibly comprehensive, just for one device type.
It has to be.
And then there's the device history record, DHR. That sounds like it tracked what actually happened during production.
Exactly right. The DHR is the production history for a specific batch or even a single unit of a finished device. It's the proof it was made according to the DMR. So it has to have dates of manufacture, the quantity made, how many were released for distribution, and the acceptance records. The proof, it passed the tests laid out in the DMR.
Got it. So you can trace a specific device back.
Precisely. And labeling is big here, too. The DHR needs documentation of who released the label when, with a signature, plus samples of the actual labels used for each unit or batch.
It's amazing how even labels get that level of scrutiny. Necessary, I guess.
Absolutely. Labeling errors are a common cause of recalls.
Right. Now we've hit DHF, DMR, DHR. The outline also mentions the quality system record, QSR. Is that another specific file?
Not exactly defined as a single file in the excerpts we looked at. Think of the QSR as more the overarching framework. The quality system itself, documented. It dictates how all these other records and processes fit together and are managed.
Okay, so it's the high-level system governing the details. Gotcha. Now let's shift gears a bit to document controls. FDA Section 820.40. What are the big takeaways here?
Well, the fundamental thing is that manufacturers must have documented procedures to control all the documents required by Part 820. Not just have the documents, but control them.
Control them how?
There needs to be a system. The FDA points to 3 key areas for these procedures: document approval, document distribution, and document changes.
Okay, let's break those down. Document approval first. Who signs off?
You need designated people responsible for reviewing documents for adequacy, making sure they're right for the job, and then formally approving them before they're issued.
Right.
And that approval needs a date and a signature. Could be electronic, could be wet ink. It establishes clear accountability. You know who vetted it.
Makes sense. Accountability is key. What about distribution? Getting the right docs to the right places.
Yeah, the procedures for distribution have to ensure that the correct Current versions are available wherever they're needed. Think about the production floor. People need the right SOP right there. And just as importantly, the procedures need to cover removing obsolete documents promptly or somehow preventing their unintended use. You definitely don't want someone using an old procedure.
Absolutely not. Huge potential for error there. Okay, and the third one was document changes.
Right. Changes happen, but you need established, documented procedures for how changes are initiated, reviewed, and approved.
And who approves changes?
Here's a key point. Changes generally need review and approval by the same function or individuals who did the original review and approval, or, if they're not available, a qualified designated substitute.
So it maintains consistency and oversight.
Exactly. Ensures changes are properly evaluated, don't cause new problems. It's a controlled process.
Okay, that covers document controls. Now, what about records more generally? Section 820.180. What are the rules for keeping these records?
The main thing is they have to be kept either at the manufacturing site or somewhere else that's reasonably accessible. Accessible to the manufacturer, obviously, but also to the FDA for inspection.
Reasonably accessible. How quick is that?
Well, they need to be readily available for review and copying during an inspection. The preamble mentions that for foreign manufacturers storing records remotely, the FDA expects them produced within 1 to 2 working days. So pretty quick.
Okay, that's a clear expectation. What else?
They need to be legible, obviously, and stored in a way that minimizes deterioration, no fading ink, no water damage, and prevents loss.
And backups for electronic records?
Absolutely crucial. If you're using automated systems, you need robust backup procedures. Data loss is not an option.
Right. What about confidentiality? Can manufacturers protect sensitive info?
Yes. They can mark records as confidential during an inspection. This helps the FDA figure out what can or can't be released under the Freedom of Information Act, FOIA.
Okay. Are there any records the FDA doesn't get to see?
A few specific exceptions, yes. Management review reports and results, internal quality audit reports, and evaluations of suppliers, contractors, consultants. The FDA doesn't get to review or copy those specific reports.
Oh, wait, there's a catch, right?
There is a very important catch. While they don't see the results of those audits or reviews, they absolutely must have access to the documented procedures for how those things are done.
So they inspect the process, even if not the specific findings.
Exactly. The how must be transparent. And finally, retention. How long do these records need to hang around?
Good question.
It's the longer of 2 periods, either the expected life of the device itself or at least 2 years from the date the device was released for commercial distribution.
Okay, so potentially quite a long time for some devices.
Definitely. Ensures records are there if issues arise down the road.
That gives us a really solid grounding in the FDA's world. Let's broaden out now. Thinking about healthcare document management systems, DMS, more generally. What are we talking about here?
Yeah, so a healthcare DMS is basically software designed to handle all the medical records and digital documents in hospitals, clinics, you name it.
Moving beyond paper files.
Exactly. The goal is to make it faster, easier for doctors, nurses, admin staff to find the info they need securely so they can spend more time on, patient care.
Makes perfect sense. What are the big benefits people say?
Oh, quite a few. Better patient care is a big one. Getting accurate, up-to-date info quickly reduces errors.
Sure.
Enhanced data security using encryption, access controls, which is critical for HIPAA, HITech, GDPR compliance.
Right. Compliance is huge.
Cost savings, too.
Yeah.
Less paper, automated processes, better resource use. It streamlines the whole document flow. Think secure digital signatures, customizable forms, really quick search and retrieval.
That search capability must be a lifesaver.
Totally. Plus, easier sharing and collaboration, integration with electronic health records, EHRs, automated notifications for things, and like we said, robust security is baked in.
It sounds like a real game changer compared to traditional methods. Is the market for these systems growing?
Oh, absolutely. Big time. The estimates are something like $0.66 billion in 2024, growing to maybe $1.15 billion by 2029. Some forecasts go even higher, maybe over $2 billion by 2032.
Wow. That's serious growth. What's driving it?
Increased digitization everywhere in healthcare, really. Plus the constant pressure for more efficiency, better security, and meeting all those tough regulations.
Okay. So if a hospital is thinking about getting a DMS, what are the first steps?
Good question. First off, they really need to understand their current situation. What documents do they have? How do they flow now? Paper, digital, a mix?
Map out the existing mess, basically.
Kind of, yeah. And crucially, get all the stakeholders involved. Doctors, nurses, admin, IT, everyone needs to have input so the system works for them.
Good point.
Then there's the big task of migrating existing documents and, of course, choosing the right software. It needs to be compliant, IDPA, GDPR, whatever applies, easy to use and scalable for the future.
That ease of use seems critical. If it's clunky, people won't use it properly.
Exactly. Adoption is key. And we're seeing more emphasis now on features like automated document processing, using AI and OCR for intelligent data collection.
OCR being optical character recognition.
Right. Reading text from scanned documents reduces manual entry and, really important, strong version control.
Ah, version control. Let's dig into that. Why is that so critical, especially in healthcare?
Oh, man, it's fundamental. Without it, it's chaos. You risk people overwriting things, using the wrong version of a procedure or a patient record.
Which could have massive consequences.
Huge. Imagine basing a treatment decision on outdated information. Version control prevents that confusion. It maintains efficiency, organization, and accountability. You know, who changed what, when, and why.
So it avoids that which file is the real one problem.
Exactly. And lack of accountability is a big issue without it. If something goes wrong, how do you trace it back? Compliance is another major factor. Auditors need that clear trail.
Okay, so what are the positives? The benefits of good version control?
Well, easy tracking of changes, obviously. Better collaboration systems often have check-in, check-out features so people don't overwrite each other's work.
Right.
You can easily compare versions to see differences. It keeps documents safe, prevents accidental deletion, saves time, money, reputation by avoiding errors based on wrong info. Makes regulatory compliance much easier with those audit trails. Better storage, better management overall. It just automates and secures the whole process of document evolution.
Sounds non-negotiable for healthcare, really.
Pretty much, yeah.
Now, besides the FDA, we mentioned the Joint Commission International, JCI. They set standards, too.
They do. JCI is a big global accreditor, and documentation is a major focus for them. They look at a huge range of areas.
Like what?
Patient safety, access to care, patient-centered care, how patients are assessed, anesthesia and surgical care, medication management, quality improvement stuff, infection control.
Wow.
Governance, facility management, staff qualifications. It's broad.
So what kind of documents do they actually require? Can you give examples?
Sure. They expect documented policies and procedures for tons of things, like patient identification methods, how critical test results are reported, admission and discharge criteria, informed consent processes, both general and for specific things like transplants,
Right.
medication storage, medication reconciliation, how sentinel events are managed, infection prevention plans, waste disposal, the structure of the governing body. Even documented programs for things like lab safety or procedural sedation.
It sounds like almost every key process needs a documented policy or procedure behind it for JCI.
That's pretty much it. They really emphasize having those documented processes for accreditation. It shows consistency and adherence to standards.
Okay. Now, our outline mentions some expert insight from a Mr. Ravi Kumar. What did he observe?
Yeah, Mr. Kumar sounds like he has a lot of experience helping hospitals with this stuff. He pointed out a couple of really common mistakes he sees.
Like what?
One is simply not having a clear document retention policy, knowing how long to keep what.
Which we saw the FDA specific about, too.
Exactly. The other big one is not making sure documents are actually accessible to staff when and where they need them.
That sounds critical if you can't find the procedure.
Right. He stressed that delays in finding policies or patient info can directly lead to delays in patient care. He mentioned seeing nurses waste valuable time just searching for the right protocol, time that should be spent with the patient.
That really hits home. Practical impact. So what did he recommend?
His advice was pretty straightforward. First, create a solid document control policy, define roles, processes, everything.
Get it written down.
Yeah. Second, choose the right DMS. One with good version control, search, security, don't just grab anything.
Makes sense.
And third, conduct regular audits of the system and provide ongoing training for staff. Make sure people know how to use it and that it's actually working as intended.
Audit and train. Sounds like solid advice. Okay, as we start to wrap things up then, what are the big takeaways for you, our listener, from all this?
I think the main thing is that this isn't just bureaucracy, right? Effective document and record management in healthcare is fundamental. It's about patient safety, it's about efficiency, it's about managing risk.
It's not just ticking a box.
Not at all. The FDA gives a clear framework, especially for devices. And modern DMS tools are powerful. They help meet those rules, but also go beyond them. And seeing organizations like JCI emphasize documented processes just shows how globally important this is.
Right. Was there anything that particularly surprised you as we looked through this?
Maybe the sheer scale of it. The volume and complexity of healthcare documentation is just immense, and how easily things can go wrong without really robust systems.
Mhm.
You still hear about recalls for things like labeling errors, even with automation, and you read about the billions wasted on poor administrative processes. It just highlights how critical good document management really is.
It's a powerful reminder. Okay, so to leave you with something to think about,
Hmm.
a final thought for today. With AI and machine learning advancing so fast, how might future document management systems change healthcare even more? Can they revolutionize workflows, help analyze all that data, while still meeting these super strict regulations?
That's the million-dollar question, isn't it?
And how can organizations find that balance, between rock-solid security and making sure information is seamlessly accessible to everyone who needs it for patient care? It's a fascinating challenge.
It really is. Lots to think about there. Well, thanks for joining us for this deep dive.
And thank you for tuning in to the Deep Dive. We'll catch you next time.